Welcome back to Overhead Athletics. We're working with Lucas, one of our all-stars here, and we're talking about, improving some scar mobility via cupping. So one of the things we're doing here is when we have a patient post-op, Tommy John, UCL repair, maybe some olecranon screws like we've had going on here, 2 surgeries, elbow stiff, we might start with some of our joint-based mobilizations to try to improve extension, which we know is a risk factor for injury in our competitive baseball players. So we've done a little bit of mobilization here, worked on this elbow extension, some glides and slides there, but now we're going to actually move into a little bit of cupping here. So I've got a wedge to support the arm. I like to put a little bit of cocoa butter or something on the actual skin just so it's moistened up a little bit. Dry skin doesn't feel good with cupping, and dry scars don't feel good either. Really what we're trying to do with this is just improve the mobility, and we see that's a little restricted there. I can't slide that like I can slide the skin more proximally. The medial scar over the UCL looks good. The original scar, the revision surgery for the olecranon was done later on. So what we're doing here is we're trying to kind of pull the tissue from the tissue underneath it. So this traction-based therapy, which is what cupping is, can put some different sorts of inputs in the system and maybe peel off some layers that are a little stuck or adhered to one another by lifting up the skin. It's one of our only modalities that really does that. So we like to use it time to time. Scar tissue is one of the main reasons that we may use something like this, and applying a few cups around the area seems to work really well here. So one of the things we're always trying to think about is how can we better improve the sliding and gliding of surfaces on one another. One of the ways we do that is via cupping here, so that one doesn't want to stick. But what we'll do is we'll kind of move around this one, pull it around, and try to actually move some of the skin here relative to what's above it. So kind of sliding around, getting some suction, kind of peeling some of the superficial layers from some of the deeper fascial layers is pretty effective, especially when we think about how scar tissue is often implicated in soreness around a joint. So in working on the scar here, one of the things that we're thinking about also is just trying to improve right around just maybe the areas that are a little more adhered, and trying to improve some of the gliding. And what you see is the scar's a little bit stuck as you get close to that olecranon. And we find that as we get close to sometimes the periosteum, or where there's less layers or less soft tissue between the bone and the skin, those layers tend to get maybe a little bit more adhered. And we can do some sort of twisting maneuver with this cup, and I've got quite a bit of suction on there, a little twisting to kind of move the skin independent of the layers underneath. It doesn't want to slide over that aspect right near the olecranon, so let's start there and see if we can improve some gliding and sliding surfaces right in that area. It's not about breaking up scar tissue, and some of the people will say, well, you're not breaking scar tissue. I know we're not breaking scar tissue. What we're doing is we're kind of improving the movement between the layers of the skin, which you can absolutely do, and that's why we've done different videos on this in the past. See if we can glide this a little bit more. Good. And that's pretty much it. This is something you can do on yourself as well, especially if you kind of have some basic understanding. That is cupping on the elbow. You might get a little petechiae, a little bit of bruising where those cups are. That's no problem. Sometimes we follow this up with some soft tissue mobilization-based treatment, but now we've got to get into some more exercise, get them out in the gym. So we're going to go do that. If you guys are new to the channel, hit the thumbs up, subscribe. We'll see you guys in the next one.